Hey everyone, my name is Dr. Shaleigh, and I am so excited to be here with Kimberly, who is a pediatric nurse practitioner, and we are on this mission to help everyone have the best options available, especially for our kids, because they're the most important people in our lives, as they should be. So I'm going to have Kimberly just go ahead and introduce yourself and say where you're from, just a fun fact about yourself, and where you practice right now.
Absolutely. Well, first of all, thank you so much for having me. I'm so excited to be here. My name is Kimberly Steinberg, and I've been a pediatric nurse practitioner for 13 years now. I started off my practice in Maryland, and then I made my way down to Georgia about
As all
10 years
Northerners
ago.
eventually do.
Yes, I'm one of the transplants. Thank you for accepting me. But I've been really excited to be a part of the integrative medicine world for about over 5 years now. Prior to that, I spent time initially in general pediatrics, like all new nurse practitioners do. And then I made my way into pediatric ENT for a while, which is so exciting because I'm really passionate about approaching ENT issues from that holistic mindset. And then I made my way over doing what I do now, which is practicing both pediatric primary care and functional medicine at the Genesis Center in Cumming.
Which you were in practice in Roswell for a while.
Correct.
Yes, and then I know that practice very well, and you guys had an amazing patient base, and so many of my patients have gone to you and had such a great experience. And then now that you're over this way, even more exciting because it's not as far.
Yes.
So, and tell me a little bit about how you got connected with the Genesis Center and what you like that they do and what your role is there.
Yes, absolutely. So I became connected with them actually through a mutual friend who introduced me to them, and we sat down and met, and they were really interested in bringing more pediatrics on. They've primarily been doing a lot of adult care, and I think they've always wanted to get back into the pediatric space a little more. So they've given me this wonderful opportunity to just start a whole pediatric side of their practice, and I'm able to provide well care there. And that includes vaccine-friendly well care, which I know is really important and very needed in our community. And in addition to that, I can help support patients with their acute care needs with that holistic lens, which is really nice, where you might have to incorporate some conventional modalities only if they're really needed. So parents can rest assured that we only bring in those things if we feel like we really have to. And additionally, I do the functional medicine there for the kids as well. So if anyone has particular chronic issues going on, whether it be feeding, sleep issues, gut issues, behavior concerns, there's so many things. We do a deep dive and try to do everything we can to uncover root causes and address things holistically.
Which is why I'm so excited and we work so well together in regards to the patients' care that they need. And for those of you that don't know, I'll explain a little bit what functional medicine is, and then let me know if I miss anything or if you have a spin on it too. But essentially looking at the body on a functional scale. So there are normal numbers, which are based on when you look at your labs, for example. So there's the normal, which is based on the sickest of the sick, the most unhealthy people to healthy people. So the range is about this big. When you look at functional lab numbers, it's looking at healthy numbers, so the range is this big. So that is why getting to the root cause is essentially what functional medicine does, because it helps break down and get out all of the essentially those numbers that are based on people that have chronic issues and or obesity, for example, that is put into that range of what normal versus abnormal is. So that's why the term functional medicine gets thrown around a lot, especially on the internet. So if y'all seek out functional medicine, make sure that it is someone who is currently in practice, they have training behind it, and they use an integrative approach. Those are my 3 requirements.
I love that. Completely agree. Yes.
So whenever you switched, we'll say shifted mindset, whenever that happened, was there a period in time? Was there something in particular, or what kind of guided you down this holistic journey? Because as you know, you don't just wake up one day and decide that you're going to make your life more difficult, right?
Yes, correct. That's very well said. It was my personal journey, which I think many of us on this side of healthcare have experienced that. And so I, many years ago, went through significant GI challenges, and I was running around to specialists and nobody could tell me what was wrong. And I literally had, who was supposed to be one of the top GI specialists in Maryland, tell me that changing my diet didn't matter. And I was like, that makes no sense.
That is insane to me.
And told me that with my gut issues, eating gluten would be bad. or I'm sorry, eating gluten, but taking gluten out would be bad. Removing gluten would be bad because I would be nutritionally depriving myself.
From gluten? I'm sorry.
Where?
The health plate.
Where does gluten fall? And I'm having these serious gut issues, and I have this renowned doctor telling me, go eat gluten. What are you doing removing gluten? So that is when it started.
Well,
Yes.
and what's crazy is when you look at gluten and why we are all so sensitive to it right now, right? And I married into an Italian family, just to let you know, eating gluten is kind of a requirement. But it's not really the gluten necessarily. Well, it is nowadays because things have been so cross-contaminated and processed. But if you were to go to Italy and eat bread and pasta and all the things there, you would probably be okay. Obviously, there's a situation where there's celiac disease, and that's a different story.
Exactly.
But the problem is we are so chronically inflamed from all of the glyphosate and the chemicals and everything that is our food is just encompassed in, that now our bodies see it and they react falsely. So I'm sorry, that's hilarious.
It's quite stunning. And I love when you bring that up about being Italian, marrying into an Italian family. As I've healed my body, I love to cook and bake and all of those things. And I actually do have flour I order from Italy.
Same.
Yes, 00 organic flour from Italy, and I can tolerate it great. I'm so happy. But which is amazing because I know I couldn't do that with what we had here.
It is actually not even that much more expensive. Yes. Whenever you look at it, yes. Do you pay more in shipping? Absolutely. But whenever you look at the quality and whenever you eat what you make with that flour in particular, you're satiated easier. So you're not craving and wanting more and more and more because it's filled with a ton of processed things that your body can't even break down. So it goes a lot longer, which is why it ends up costing less.
So. And food, I love to tell people too, when you do your budget, right, think about all the things that you spend money on. And the number one most important thing you can do is give yourself quality food. And it can be so challenging, especially today, but we just have to find ways to try to make that the priority in the best ways that we can. And it's not always going to look perfect, and that is okay. Just moving that up in the priority list can make such a big difference too.
Speaking about kids, they don't buy their groceries. They're going to eat what you give them. Or they sneak at church camp, but...
that too, that happens.
That too. But you are their sole provider of what they're going to consume. And if you teach them to eat and prioritize what they're eating, then you're saving them from a life of health disparities down the road. Which is why I love having providers that are on the same page.
Absolutely.
Which is so great.
Absolutely.
So referencing a few of the things that I wanted to go over, I honestly Googled most common questions that people were asking about their kids.
Perfect.
Right? I know. And I'm honestly very excited that people are asking these questions because that means that we're at a crossroads of people wanting to live more holistically.
I love that parents are coming with questions. And I tell people that all the time too. Please come with your list of questions. I want your questions. Nothing is too crazy. Do not feel a certain way about asking anything. And if it's something I do not know, I will find out for you.
Yes, and that is why I love you as a provider, because we're also very big on education. I always say, well, doctor means educator. It means teacher. And our job is literally to teach people about their health, about their body. We didn't go to school for a bazillion years so that we could keep all that information to ourselves. We went to school so that we could learn it and we could teach other people how to utilize it, because if they don't know, it doesn't matter. Then they're in the dark and eventually they get these symptoms and it might be too late. So what the questions that people are asking, especially about holistic care, is number one, is holistic pediatric care safe? Which I actually thought was funny.
That's a really, I'm happy they're asking.
Yes, but they're asking, which is good.
Absolutely, that's great. I would love to talk about that. Yes, it is so safe because we address the entire body. So holistic pediatrics is about addressing really the mind, the body, the spirit. And it's really looking at things from that natural perspective, right? We're looking at everyone's unique biology, how it works in that person from a very individualized perspective is really what holistic care, I think, does a great job with. And so to me, it's obviously one of the safest forms of practicing medicine because it's so individualized. We're taking the whole body into account, and we're choosing things that naturally support the body in the best way possible. And so I would love for people to ask more specific things about that as well.
Yeah.
What about holistic medicine has you concerned as a parent? And I invite anybody to come to me with those questions, and I would love to unpack that and go into that, because I know there's probably lots of different angles people have concerns from.
And that's why the reason I think it's a funny question is because another question that is commonly asked is, are antibiotics safe? Are those something that I should be giving my child, or is that something that could harm them?
Right.
And the answer is yes and no.
Correct.
And that's where having a holistic provider on your team that also has the ability to prescribe if needed. Antibiotics they're one of the most amazing discoveries that we have made. And do we overprescribe? Yes.
Yes.
But is there a time and place where they are needed? Absolutely.
Yes.
And then is there a protocol that you should follow after
Correct.
to restore the biome? Absolutely. Which is where having those options available and building your pediatric team is one of the most important things that you can do for your kid, because I don't say kid a lot, kiddo is more so what I say. Building that pediatric team is one of the most amazing things you can do for your kiddo, because then you have everyone in the position when something is needed.
Absolutely. And you bring up a really great point, and people think that holistic always means we never go to conventional options.
Yes.
And I know there's a lot of confusion out there. What's functional, which you explained so beautifully. What's holistic, what's integrative.
Yes.
And it is so confusing. And I often categorize myself as integrative to help drive the point across that, yes, I lead with holistic, but I will invite in these other treatments as we need to, being very judicious about it.
Yes.
And so those terms can get so confusing. And
They can. And
it's
a lot
hard.
of, I'm not trying to bash the internet, because
Right.
I love that
Of course,
resource.
yes.
But sometimes I think take advantage of the fact that, we can just give them this detox and that should fix everything, right? The word detox is spreading the nation right now.
Yes.
I'm sure parasite detox, right? Which is an amazing tool if that's what you need and if your body can handle it.
Exactly.
That's
Bingo.
a big question, because the side effects can honestly be worse than the symptoms sometimes.
Yes.
So again, making sure that you have providers on your team to be able to answer those resources and then intervene integratively is what we'll call it, if necessary.
Absolutely.
Right?
And detoxing for children needs to be done very carefully.
Yes.
Is it necessary for kids? Many kids, of course. And there's lots of different things that we can do. But it is very nice to have that a little guided. Like you said, if they do have die-off reactions and things that can be kind of problematic. I know it's so hard because it's difficult to find someone to walk you through that. But yes, that's a big topic that I help address with families.
Good. So that, just so people watching or listening can find you, that is something that you could help them through is detox.
Correct.
If that's something they're looking for.
I have patients come to me and they're like, I really want to detox my child from XYZ. Let's talk about it. And I'm like, wonderful. Let's see how we get you your goals. And I like to work with people. So people come to me with those goals all the time.
Awesome. So one of the other common questions was, how can I support my child's immune system naturally? So what are some things that you would tell your patients? If I was a mom sitting here asking you that question, what would you say?
Food.
Okay. Yes.
So the food will always be there. Diet, nutrition is always going to be the most foundational thing. And I tell people that 70 to 80% of our immune system resides in our gut.
Yes.
And so gut health is so important for so many reasons, but that's a big one in how it relates to immunity right there.
Yeah.
It's just so key. And then, of course, I think the next most important thing is honestly getting outside every day. Vitamin D, getting your circadian rhythm set by getting that first morning light. We're then going to bed at a better time and hopefully getting more restful sleep. I know sleep, it's huge for the immune system. It's not always possible for parents and children, so I'm not expecting anybody to have a perfect sleep schedule. But that's just another thing to prioritize to the best that you can, because if our bodies are not getting as much rest as we can give them, it's very hard for them to be healthy. And so that would be my other big thing. And then I know people always like to know what supplements, that kind of thing can we do? And I
The
think
green medicine trick.
yes, what is that? And supplements can be so beneficial. Do I use them all the time? Of course I do. I like to lead with, of course, your most natural food sources and all the things that we just talked about. But probably the most important supplements, knowing your vitamin D. A lot of us need vitamin D support. And it's very difficult to have enough of that just through diet. And sunlight is probably adequate during the summer for some people, but not necessarily all. And then certainly during the winter, it can be hard. So that's a big one that comes up in terms of protecting the immune system.
So we have
Food.
We have vitamin D, which is getting outside, circadian rhythm. And then you also said about if you're going to supplement, vitamin D is a big one that we don't get. So you've given me 4.
Great. Cool.
So.
That's funny. I don't think any more than that.
And I couldn't agree more about supplementation. That is, if there was one question that I get asked consistently each week, it is, what vitamins should I be on? What vitamins should I be giving my kids? And my first question is, well, what are you eating, first of all? And or what are your kids not eating? Because that's always a fun one. If they live on chicken nuggets and mac and cheese, then we might have to introduce, actually I would highly recommend introducing a daily multivitamin.
Absolutely.
Just make sure it's from a good source. I have a few that I love, and until they prove that they're not good, then I will keep promoting them. But I tell people consistently, my goal is not for you to be on these supplements forever, but we are aware that our food sources have been altered.
Correct.
And they've been genetically modified, and they're not as nutrient dense as they have been in the past. So sometimes we might need to consistently give that supplementation with the idea of trying to pull back and seeing if you still need it.
Absolutely.
Right? But yes, food is the number one thing that I would recommend. I love that you pointed out the gut. As a chiropractor, that is my immune boosting skill, is what we'll call it, is working on the upper cervical spine, which your vagus nerve then comes down, integrates your gut. So when families are sick and they say, I don't want to come in, we have a whole protocol in place where we'll see them in a room. I never get sick, so I'm always the one to go see them. So we'll see them in a room, and 9 times out of 10, especially if a kiddo has a fever, one of 2 things happens. It either spikes and it goes away the next day, or it will just dissipate after that adjustment. So that is my claim to fame, is what we like to call it. But then obviously trying to supplement as much as we can ahead of time, so when they do get sick, they get better faster.
Absolutely.
Which is the ultimate goal.
It is.
So the third question was, why is my baby so gassy, fussy, and colicky?
It's one of my favorite things to help parents with.
Because they're miserable and they're sad.
Yes, and it's so distressing. And then they might go to their PCP and they're like, it's colic. And what do I do? And they're like, it's just colic. And
or it's gas. Just put them on these gas drops.
And the thing is there's actually so much you can do. And so I love helping to walk families through this. And especially when it comes to that with reflux too, it is so multifactorial. There are so many different angles I like to look at it from. So you have the gut that we love talking about. So figuring out if baby is breastfeeding, having a conversation with mom about her diet, trying to tease out things that could be contributing from there.
Which I don't know about you, but getting moms to stop dairy is probably my biggest battle.
It's so hard. That's a tough one, I know. And I love trying to just walk moms through that and support them, because it's such a hard
I'll cut it out
thing.
With you. We'll do it together.
I know. It's so tough. I agree. And also thinking about these babies from a functional perspective, the anatomy. Do we have ties that are contributing to how we're sucking, swallowing? Is that bringing air into the digestive system and contributing to symptoms? The other side of it too is also thinking about, was this baby a C-section baby or a vaginal birth baby? You have to support the gut differently just based on that. And is that maybe a foundational thing that could be contributing to some of the symptoms?
I love that you said C-section baby. So I actually just got asked this 2 days ago. It was someone who was shadowing our office, and they said, hey, so I've heard that if you're a C-section baby, then your gut is messed up from day one. I was like, no. C-section is an amazing surgery that I'm very thankful that we have.
Absolutely, yes.
I'm a C-section baby because my brother was a C-section baby in an emergency situation, so he probably wouldn't be here without it, right?
Yes, absolutely.
So very thankful for that. But also, when babies are born prior, and you know this, but this does, they're safe and encapsulated, right? And then they come to the world and they're exposed to bacteria for the very first time in the vaginal canal. And so if they're a C-section baby, they're not exposed to that same bacteria for the first time, which is the start of them developing their own gut biome and their own immune system. Because especially for the first few months of their life, they're completely reliant on mom's immune system.
Exactly.
So that first initial could be why, if they're not getting that, why then they react differently and gut is off earlier.
Yes.
Right. So that's a great, I love that you asked that question because that's something I asked too.
Absolutely.
And going back to the pregnancy, what was mom's pregnancy like? What did she have a ton of acid reflux, or did she have stomach issues? Because again, she's growing the baby, and from a very, very early state, and they're starting to develop their own digestive system, which is why going the whole way back is so important.
It's so important.
Okay, so question, and I think this is the one that I'm the most excited to ask you about, is you worked for an ENT specialty for a period of time, right? So can you tell me conventionally what the process was for kiddos that had an ear infection or chronic ear infections?
Yes. So, and parents can definitely to this as they, if they've gone the road of going to an ENT for evaluation. But typically you see the child, you look, do we have fluid today? Do we not? Depending on what the fluid looks like, sometimes more antibiotics are prescribed. And then if you meet this certain criteria with number of infections or how long fluid's been present for, a recommendation will be made for putting in ear tubes or for doing an adenoidectomy with that. Basically, adenoids are like tonsils that sit in the back of the nose, and they can become problematic if they become or enlarged. And so not to say that there aren't times where some of these things are needed, right? Just like we're talking about with everything else. But it's so incredible to see how much we can do without having to rush those surgical options. And I just love for people to give it a try, right? You know, I know it's up to every single parent's, preference of ultimately want to treat it. But huge things that is thinking about, again, back to that oral motor function idea. What's going on with the anatomy, like even in the mouth, the surrounding structures that could be contributing. What is our diet like? This is in and all of that. Also thinking about general history, like are we dealing with, do we have gut issues going on? Because everything is connected in the body. So trying to piece that all together. So the approach that we can take with the holistic world is something that we can really, really help with in the world.
Just to explain the anatomy behind that a little bit is when babies are born, and the reason that kids are so prone to ear infections at a younger age versus they kind of grow out of it, especially by the age of like 4 or 5, is when they're born, their eustachian tube is flat. And then as their face elongates and they develop the oral strength, like you said, oral ties, so they develop the strength, they have a better suck, they start teething and introducing more solid foods. That helps elongate their face, and the muscles are able to contract better. And then their tubes start to drop. So then the fluid that will get stuck in there, especially during allergy season, will start to drain better, right? And that's the goal, is just to get them to that point, so then they probably won't have ear infections after that, or it'll be like swimmer's ear, and that's an easy thing to treat. So ultimately, if that kid's getting ear infection after ear infection, parents make the choice to get tubes, then same thing with an antibiotic. You want to help restore the gut. You don't want to ignore that it might have been oral ties. You still want to try and prevent them from having secondary issues long term. And a big thing I see, and I'm sure you do too, is kiddos that have chronic ear infections usually have, those oral ties, but they also are usually mouth breathers. So I see a lot of kids that have sleep disturbances, which then can be misdiagnosed as sleep apnea at a younger age. And I mean, I've had 10 years on CPAPs. Which is crazy timing for it. But also, what if we would have caught that earlier and not had tubes, them not their tonsils and their adenoids removed, and then maybe they would have been able to breathe on their own and developed that strength properly. So that is something I would say. What's the number one thing I probably get referrals for? It's ear infections. It's to help everything drain and work better. And that is why I love working with holistic practitioners that can help guide through that process, because ear infections, when your kid is miserable, it's a scary thing.
They get those high fevers with them, and they're crying all night, and the parents are exhausted, and then
they're not sleeping because they
it's the most challenging things, and my heart goes out to every parent that has to deal with that. And so know that there are ways to leave.
Okay, so the next question I have is, what happens if my pediatrician threatens to kick me out after that first year because I refuse to vaccinate?
That's a great question. Every parent needs to know that it is your choice. You have a right to make medical decisions for your child. And nobody should tell you that you are right or wrong in terms of what those choices are when it comes to this issue, in my opinion. If that happens, you say, okay, thank you very much. And you come and you me.
Yes.
We're out there. I know we might be really hard to find, and I think that's changing a little bit.
Becoming more common.
I think it's becoming more common, thankfully. I think there's a lot of healthcare providers out there that are starting to realize some things as well. Again, at the end of the day, I'm not going to sit here and take a stance on, pro or con. I like to consider myself, I am neutral, and I am for the parent because it is my job to be unbiased. It is my job to be a safe space for you to ask questions, whatever they may be, and for me to be able to give you answers that are completely unbiased and based on research that I have available from a lot of different sources. But yes, if you are a parent and you are getting dismissed from a practice because of that, you need to find another provider.
And that is such a great way to put it, is that our job as healthcare providers is to be neutral on a lot of issues. And regardless of personal opinion, that doesn't matter.
No.
Personal opinion means nothing when someone's about their health or the health of their child. It is, again, educator. I will say it over and over. It is to provide the information. But one thing I highly, highly encourage parents to do is to also read the research that's given to you. My mom was the queen. Well, they just told me to do it, so I just did whatever they said, right? And again, she didn't know any better.
Right.
But we are blessed with so many resources at our fingertips that if you are questioning something, you can find answers.
Yes, you can.
And you can providers and people that you trust to find the resources and to help vet information for you.
Absolutely.
Because there's also a lot of fake news.
Yes.
So you want to be able to have a pediatrician that you can trust, have a provider that you can trust, have, in my opinion, a chiropractor that you can trust,
of course,
right?
yes.
So have providers that goes back to the team that we talked about, that team for your kiddo, to make sure that they ultimately are the most optimal life that they possibly can, right? Because we have a law against us, and we want to help them avoid health disparities that we are now dealing with.
Yes.
For the terminology, but we're of the generation that was like, oh, well, we did that, it's fine.
Yeah.
Like, I ate that, right? But are we really?
Right.
I don't think we're fine. Chronic disease is at a peak. Health disparities are at an all-time high. There are just so many things that are wrong with what is our generation. It's time for change.
It is.
Yeah.
It absolutely. I think it's so wonderful for parents to be able to have like someone like yourself, someone rely on us to sort through some of that, because it can just get very daunting, and you don't necessarily have to do every crunchy thing, that you
don't have to be a research analyst.
No,
that's why you have people that you trust
exactly.
and rely on to give you the information to sift through yourself.
Yes.
And the way I sought out a good provider is essentially, do they have resources for me to look at myself?
Yes.
And then from there, you can make the decision on, okay, yes, I want to go with this provider, or no, this isn't the one for me. And then be able to make the best decisions for you and for your kids. I want to go ahead and wrap up a few thoughts. So if I were looking to be a patient of yours, well, I'm not of pediatric age, but if I had a kiddo and I was trying to find a new pediatrician, how would I contact you? Where could I find you? Do you have an online presence?
Yes, absolutely. So again, the Genesis Center, which is in Cumming, and so you can get into me or schedule an appointment with me through their website or their phone number. But then I also have an online presence. I have an Instagram page for myself, which is at Kimberly PNP, so pretty easy to find. And I love to, collaborate with people. I love to communicate with people on there. So, people can ask. I'm happy to respond. And that's where you go.
To wrap everything up, thank you for doing this podcast with me. That was so fun.
Well, thank you.
I know we met over coffee, and I've sent patients back and forth for a while. So it's great to now have a resource for my patients to utilize.
Yes.
And I think it really give peace of mind for parents on, oh my gosh, it's not a facade. Really are pediatricians that are more integrative, right? Because you hear it, and some people talk about it, but it really has been a topic that is needed.
Yeah.
So thank you for that. And then one thing that I wanted to provide everyone is we have a free resource called Kick the Sick. So I'm going to go ahead, and there is a link that you can click below. It is what I call cheat sheet for when kiddos are dealing with a fever, when they're dealing with sinus issues. There is a time and place for supplementation and holistic options. So I'm going to go ahead and just give that to you guys for free.
Love that.
So it's a resource. You get talk to your providers and see what they think. Give me your feedback on it. I've got no negative feedback so far. So
I looked at it, loved it.
Okay, awesome.
Thought it was great.
It just breaks it down in different categories on what to do whenever you wake up in the middle of the night and your baby's screaming and you're so tired, and is there something in my crunchy holistic medicine cabinet that I can use, right? So it's a great resource. Make sure you check it out, and then check out Kimberly. Make sure you follow her, and let us know if you have any questions.
Wonderful. Thank you.
Yes, of course.
Appreciate
Thank
it.
you.